Good morning and welcome to the Gilf's Den, the podcast that delves into the fascinating world of human relationships, personal growth, and societal change. I'm your host, Stephanie Smith, and today I have the privilege of introducing you to a remarkable guest whose expertise spans the fields of sex therapy, gender feminism, and parenting. Joining us is Dr. Tina Schermer Sellers, a licensed sex and gender feminist psychotherapist, best-selling author, researcher, emeriti professor, and media personality. Dr. Sellers has dedicated her career to shedding light on the impact of patriarchy and sexual shame on our ability to form secure relationships and raise confident children. Dr. Sellers has become a sought-after voice in the realms of spirituality, health, and social justice. Her work has been featured in prestigious publications such as Spirituality and Health, Refinery 29, Vocal, Medium, and Bust magazines, as well as on various podcasts and radio shows, news outlets, and TV programs. Dr. Sellers' latest book, Shameless Parenting, Everything You Need to Raise Shame-Free, Confident Kids and Heal Your Shame Too, has struck a chord with parents and individuals alike. In this groundbreaking book, she offers valuable insights and practical strategies for nurturing shame-free environments that empower both children and adults to embrace their true selves. Throughout our conversation, we'll explore Dr. Sellers' mantra that sex is better without shame and how eliminating shame can lead to healthier and more fulfilling relationships. We'll dive into her research, experiences, and expert advice on fostering secure attachments, spiritual intimacy, and navigating the complexities of parenting in today's society. Boy, get ready to be inspired as we delve into the transformative wisdom of Dr. Tina Schermer Sellers. Her expertise will challenge our preconceptions, ignite important conversations, and empower us to create a future where shame no longer holds us back. So, without further ado, let's welcome Dr. Tina Schermer Sellers. Thank you.
Thank you so much, Stephanie. I'm so pleased to be here with you, and I'm looking forward to our conversation today.
Yes. Yes. So tell us about shame. I mean, we are in a really difficult time right now where parents are having a very difficult time finding out how to talk to their kids about sex. So let us know, how are you doing this? What kind of impact are you making?
Gosh, good question. Well, shame is really inherent in our culture, and it has been for a long time. And sexual shame in particular. So many people have been exposed to the work of Brene Brown, which is brilliant work. And I think it's really helped us have an understanding of shame that's more household now, right? So, that sense of not being worthy of belonging and love deep down inside. We just feel not good enough at a real deep core level, and that we can't possibly be worthy of love, or possibly be worthy of people really wanting us to be a part of their circle, right? And but the work that I've been doing has been looking at shame, sexual shame in particular, and religious sexual shame specifically. And what I've come to believe in the United States, where we don't provide comprehensive sex education, so we're really leaving kids and people to just absorb the reactivity of their parents and grandparents, which makes them feel like something must be wrong with me. These curiosities must not be okay. And then what they get, they get from friends and media, which media is fantasy entertainment. It's not an educator, a good educator. Like, we don't drive like Fast and Furious, and we don't climb buildings like Superman or Spider-Man or whatever, like we understand the difference between entertainment and real life. But around sexuality, we actually don't, because so much media is what's providing the quote unquote sex education, because when people ask parents just like, you can't ask about that. You can't talk about that. They get upset. But when we look at child development, kids are often finding their genitals somewhere around a year old. By that point, they know that their hands can grab things, reach for things. They're getting that coordination figured out. So somewhere between 10 months and a year or 14 months, their hand is going to land on their genitals when they're getting their diaper changed, right? Or when they're in the bathtub. Now, if a parent is there to say, yep, that's your penis, or yep, that's your vulva, it's a fabulous part of you, and it's got lots of nerve endings, so it feels extra special, then the kid just goes, oh, that's another thing I've learned. Just one more thing. But if a parent gets angry, slaps their hand away, right, says, don't, yuck, dirty, move your hand, whatever, then the child gets a sense of, this person who's most important to me in the world has just gotten angry with me. And all they can think in their rudimentary way is it must be me, because they can't figure out that they've done anything except for just be themselves, right? Just be curious. Well, if that's happening at a year old, but we don't really lock down our memories until we're about 5, then they're doing it every day, every other day, whatever. And parents are getting mad every time, all the time. But they're not remembering it because this is all really pre-verbal until they're like 5 and they're playing doctor and they get in trouble. That one they might remember, hold on to. But you have to assume that hundreds and hundreds of experiences have happened from year old to 5, that they've been locking down, something's wrong with me. I'm not okay. Something about me and my body are getting me in trouble, but they have no understanding. And so I believe that sexual shame is our first shame and our deepest, most consistent shame. And that underlies all the other shame that we might acquire in our lifetime that makes us feel like, I can't believe anybody who loves me really loves me. And so I'm going to put on a mask. People will fall in love with that mask, but then I won't really believe they're loving me because they're loving my mask, right?
True.
So it hits the deepest part of our attachment relationships and where the core of our happiness is, right? So, yeah, I can talk about this for days, but that's sort of the
No, it's
little
beautiful.
bit
It's
of
so
the,
right.
yeah.
Just to beep in, you are 100% right. I was raised that way, and I
Mm,
know lots of other people were raised that way, and very shameful. That's nasty. It's disgusting. Don't touch that. And always felt shame as a young kid. I went into not doing that later in life at 18. I'm like, oh, I changed. I was like, no. But but still my core family was still that shame about sex and things like that. So I know so many people. I do deal a lot with couples in dead bedrooms and things that lots of issues in between the sexual. And this would be huge if they can, because I think you're right. We have this thought that how can I be loved that
yeah.
way? And it's a very lonely feeling. And then there's like this trust thing that can I really trust this person? He said they're saying they are, but how do I really trust them?
Sure.
So it's it's amazing. Yeah.
Yeah. And I think that question, which is such a core question for lots of people, how can I trust this other, is is maybe in some ways more accurate to say, I can't trust myself. I can't trust myself. I don't think I'm worthy. So that's why I can't trust you. So it comes back to the fact that they've got work to do. They've got emotional work to do in order to see themselves as precious, beautiful, unique, amazing, worthy of love, worthy of pleasure, worthy of connection, worthy of fun, just a rich life. That's something we all, it's our birthright, but we get so talked out of it so early and so consistently that then we question everything, but often that question is going out there when really it's a reflection of our questioning in here. inside.
Mm.
And so I'm
Wow.
often talking about both the Sex, God, and Conservative Church, Erasing Shame from Sexual Intimacy, both that book and in the parenting book, about the role that shame has played and
Mm-hmm.
how we go about healing that shame so that we can begin to open our hearts to receive the love that's there for us because we believe we deserve it. So then now there becomes a free flow between the love I want to give and the love that's there for me to receive. It qualitatively changes your life when you
Well,
move shame out of the way.
100%.
Yeah.
Huge. Wow. So, I mean, this is something that, like anyone at this age in life would benefit, because it's not just for parents to help teach their kids, but it's for their own healing,
Yes.
because that's what we need to do, is our own healing, to
Yeah.
have amazing relationships. Like you say, that's the only way that we'll have very trusting, amazing relationships, if we do that. So amazing. Yeah.
Yeah. Yeah. A few years ago, gosh, this was, I think, 2017 now, but I was sitting on the doctoral dissertation committee of a person doing research on sexual shame. First research ever done on sexual shame. So we had research on shame, like Brene Brown talks about. We did not have research on sexual shame. So she did a qualitative study interviewing people about their lives, and shame became a part of it. Out of it, she distilled a definition of what sexual shame is. And I'd love to read it to you and for your
Sure.
listeners, because it's the
Love it.
first researched definition of what sexual shame is
Mm.
and its impact on us and our lives. To me, it's mind blowing, even though as
Mm-hmm.
a therapist, I saw this all the time. To see it in black and white through research was so affirming of what I had been seeing in my office, right? So here it is, the operational definition of sexual shame. Sexual shame is a visceral feeling. So it's in your body, deep in your body, a visceral feeling of humiliation and disgust toward one's own body and identity as a sexual being, and a belief of being abnormal, inferior, and unworthy. This feeling can be internalized, but it also manifests in our interpersonal relationships. So between me and other, right? Having a negative impact on trust, communication, and physical and emotional intimacy. So
Yeah.
every way we bond, it affects, right?
Wow.
Sexual shame develops across the lifespan, like I was talking about. So from pre-verbal, in interactions with interpersonal relationships, one's culture and society. So all the messages that we start to get about how we're not good enough, right, from culture that runs our economy. Yeah.
Mm-hmm.
Um, and a subsequent critical self-appraisal. In other words, it starts that inner critic that even if we're not getting something from someone out there, pretty soon the inner critic is already going off on us. Oh, that looks terrible on you. How could you think that? You're such a pervert. I mean, that inner critic
Right.
is going, and it
Mm.
creates this feedback loop, right? Between what's happening on our inside and then what we're getting on the outside. So it's a reinforcing feedback loop. Furthermore, sexual shame reflects a vulnerability and a distrust of one's own ability to make decisions related to safety and autonomy in sexual relationships. So, the way we see this is in our culture, and this is not just people from religious backgrounds, but it's people from all, because now it's everywhere, right?
Mm-hmm.
Is that Peggy Ornstein wrote a book called Girls and Sex years ago. She interviewed 80 women, about 15 to 22, about what's it like to grow up now. And she said, you would have these young women who were so confident and competent in every area of their life until they got ready to go out. And then they were putting down 3, 4, and 5 shots of hard liquor because they didn't know if they could keep themselves safe or if they had the right to. That is deep sexual shame inside a rape culture, because we raise
Wow.
boys that women are there for your pleasure and you don't have to care for them, right? Like that's their overriding message. And even if their heart says that's not okay, they think all their friends are thinking that. So they kind of better think that, right? It's the boy club. And so this is, we see this in that definition, right? That they don't know that they can keep themselves safe or that they have the right to. That shame
Right.
says, well, you kind of deserve it, right? Look what you're wearing. You're
Mm.
going out at night. You're drinking. You're whatever. It's all reinforced by culture, but that's what it looks like, and it's affecting the interpersonal relationship. It's not affecting them when they're studying for their career or their whatever. It's not there so much, but it's here in the intimate relationship, Yeah. Pretty
Wow. I
powerful.
mean, it is really powerful. You breaking it down that way, I've never heard it that way. And I think that it could really help a lot of people heal from, we're shamed about a lot of things throughout our lives. And, having that supportive group around us is great. But sometimes they're shamed too. So their shame comes onto our shame and it all just kind of piles. So, um, just quickly, I'm really big on this topic because I was shamed, and just because Catholic, religious based Catholic, just you don't do that. Even though my dad's mom had 15 brothers and sisters. And so, but that's just for procreation.
Mhm.
So there are lots of contradictory stuff. And so it wasn't until I rebelled against all of this when I was pretty much 17, when I
Mhm.
asked my mom how many times she had sex, and she told me 3 times: your sister, your brother, and you. And I'm like, no. And she goes, yeah. Well, I believed her because she's my mother. She's my, and I'm like, ugh, that sounds horrible. Oh my God, forget that. And then I went off on my own quest.
Mhm.
And I think that there's not a lot of people like me that would do that. You know what I mean? Like
Mhm.
some people would go, well, I guess that's just how it is. I talk to a lot of women. I can't wait till I don't have to have sex anymore after marriage. Oh, once I get married, that's not how it works. So intimacy, being shamed about our bodies, and not even just that, but our sexual needs, is horrible. It's been
Mhm.
really everything I read from men, women, all
Mhm.
over the place, young kids. It's a big problem.
Yeah, it is a big problem.
And now with this stuff going on in schools where we've got teachers doing all this, how do you, I mean, like that's confusing then too, like talking about things that maybe hasn't been talked about, lesbian, gay, gender, all that stuff, which I'm good with. But if you don't have the right parent supporting it, it could be really negative, you know?
Yeah, I actually think that kids, one of the things that's happening in culture right now, and another reason why it's so awful that we only have 18 states out of 50 that require medically accurate sex education. Not even comprehensive, but just medically accurate. 18 states, that's it. That's it. And so we're not providing them the information, but kids are talking amongst themselves. They're like, I think I'm non-binary. I think I'm pansexual. I think I'm whatever. And kids are like, but they're trying to figure this out just amongst themselves because nobody is really there. If a teacher is there to explain some things, that's actually probably giving some context to them if the teacher is accurate. Now, we don't require teachers to do sexual health training or to understand sexual biases. We don't require that of our physicians. We don't require that of our therapists. We don't require that of our clergy, right? And yet these are the people that are talking about these things all the time. You have to go on after grad school and do specialized training in sexual health and anatomy, physiology, all of it, and on sexual biases, right? So you
Mhm.
understand what's sort of accurate and true. You have to go on and do that. And maybe 5% of therapists and less of physicians, teachers, and clergy are trained in sexual health on top of being trained in individual, couple, whatever. So most couples therapists out there have done no training in sexuality, and they grew up in a silent and shaming home. They got their information from media. And so that's what they bring in to their therapy, is what they think is true, which is often a myth. It's not helpful. And so I think we've got some teachers out there who've done some work and they're able to say, well, let's talk about what gender is. I mean, if you guys want to understand it, lots of times what we're born with feels exactly like us. We're assigned girl and we feel like a girl. Even if we're a tomboy, we feel like a girl. We don't feel inside like we are a boy, but there is a small percentage of people who their inside says, I'm not what I was assigned. And that's called gender, what you feel, your identity, what you feel like you are. And so, yeah, Susie's transgender. When we honor that, because we want to honor who she authentically is in the world, and so we say, okay, if that's right for you, then we honor you because you're worth being loved and honored. Right. And so, you can have a teacher who gives the kids some context and they're like, oh, okay, yeah, that makes sense because I have boys parts and I feel like a boy. That makes sense to me. You know what I mean? But there's very little places, like Washington passed, I think 2 years ago, comprehensive, medically accurate sex education. And so kindergarten to 5th grade is really about relationships and autonomy and consent and knowing how to treat people with respect and knowing how to be treated with respect. All of those relational components that are important. And then come about 5th grade, they start going into anatomy and physiology, and they go into more complex relational skills, like why we listen, why we continue to ask, is this okay with you? Is this, you can say no, blah, blah. We teach them more complex, kinds of things. Kids need things at every age, which is, what I show in the Shameless book. Kids need things but they don't need the same thing. And they don't need one talk. They need 100 1-minute conversations at least over the course of their growing up,
Right.
if they're going to feel supported and feel equipped, like you've got to be able to talk about what power differentials are. Well, that looks really different when I talk to a 4-year-old about, well, did that feel fair to you? If it didn't feel fair, then maybe there's a power thing going on here. So let's talk about that. Like, what do you need in order to feel safe? Like what you start talking, just little conversations, but to the 10-year-old, you're like, dude, you're pushing your power around and your sister's 5 years younger than you. Would that feel fair if you were the 5-year-old in this situation? They're like, no, well, that's an abuse of power. We've talked about this at other times, but I need for you to pay attention to this because you're a boy. You're going to be told people are for your disposal and you are white. So you're going to have so much privilege to misuse your power in your life. I need you to learn this now. And I need you to pay attention to others now because you are responsible for everything you say and do. No one else is responsible for your choices. And so you're giving a much different message at 10 than you're giving at 5, than you're giving at 15. But it's building on all of these concepts. All of these concepts build over time. And parents really do need somebody to hold their hand and be like, okay, this is what you want to cover these years. This is what you want to cover these years. These are the books you want to have, whatever. Because people just haven't been equipped. They weren't equipped and they don't feel equipped. And yet we are living in a time when kids need to be equipped to recognize exploitation, to have voice, to know what they want, what they don't want, to know that they do not in no way ever deserve to be hurt or abused or any, like they need help. Desperately need help. Yeah.
Because that's not how we were raised before. And, my generation and before and all that. So, I know for myself raising my boys, and I took the whole sex therapy route, but always told I couldn't make money at it. What could I possibly teach anybody? So I had to stick with my career of where I made money, which was healthcare. But
Mm-hmm.
I have my degrees in human sexuality and always had a very open mind. And so raised my boys with that philosophy.
Mm-hmm.
And I will say, I mean, and I will have them on at one point, but I feel like because they started touching themselves and doing things, and I'm like, just real about it,
Mm-hmm.
playing right in front of me in the living room. And I would go, honey, that's a very personal thing to do, but we do that behind in our bedroom.
Yeah.
Oh, well, why? And I go, would you want to see me doing it with you sitting here? Ew. I'm like, exactly.
Yeah.
Those are things that we do in our own room by
Mm-hmm.
ourselves, and it's
Yeah.
private and it's special. And I mean, I know all the questions that and because I never made them feel bad, shame about what they were thinking, and they just could ask me any question and I never I'm not, never did that. They grew up to be, I feel like, sexually healthy people.
Mm-hmm.
And they're really amazing,
Mm-hmm.
men. But I see a lot of people around me who didn't raise their kids like that.
Yeah.
And the difference is phenomenal. And now, today, like you said, the 1 year olds, see, it wasn't like that before. Now the 1 year olds are doing that. And you're right, the shaming and all that. So I have grandchildren, and my son, we had to talk about it. I said, no shame. They're
Mm-hmm.
going to be touching it. I mean, that's the thing.
Yeah.
Yes, and identify it, and it's yours, and we talk about, and he's been doing that, so it's really cool to see.
Yeah.
What you're saying is what we need to do, but what how can what are some effective ways that we can help parents? Because see, they may learn it at school, but the parent isn't comfortable at home.
Right.
How do we
Exactly.
build that gap? Because then the kid comes home, tells the parent, and the parent goes, oh, what are
Yeah.
they talking about? I'm so mad. Oh my God, don't talk about it. We're not talking about it. So, how do we help? How do we do that?
Yeah. Yeah. I love that question because it was actually the question that wrote the Shameless book. Because I had people coming to me saying, who had read my other book, the Sex, God, and Conservative Church book, who read that book and said that I helped me liberate myself. It helped me start to see myself in more loving ways. It helped me let go of so much of the shame that I was holding on to. But I have a new problem. I don't want to raise my kids like I was raised. I'm really clear about that. But I have no idea what to do. I just know I don't want to do that, but I don't know what I want to do. And so I'm like, I got you. I've been training physicians in this and therapists in this for 30 years. I will figure out something for you. And and I had tons of physicians and teachers and therapists saying that, like, can you give me anything that will help me just support my patients, So shameless parenting is divided into sections: birth to 2, 2 to 4, 4 to 6, 2-year increments up to the age 18. And what I do in there is I say, here's the behavioral tasks most kids at this age are trying to accomplish just inherently. Here are the emotional tasks they're trying to accomplish inherently. Here's the sensual and body curiosities and relational curiosities that are likely to emerge in this 2-year time frame. And then I ask a bunch of questions like, how does it sit in your body when you imagine your child expressing these curiosities? Do you feel yourself feeling reactive? If you do, you earned that because somebody didn't treat you the way you needed to be treated when you were there. That's what shame is. It's that reactivity in us. So then I ask a bunch of questions that they can journal on to kind of dive into what maybe happened for me then. What would I have wished would have happened for me then? And just so people can begin to heal some of their own shame. And then I say, so here's what your kiddo needs from you in this 2-year time frame. Here's the top books and resources right now for you, for your kid, and the top websites. And all you need to do is be 2 years ahead of them. That's all you need. You don't need to be more than that. Read
That's
where they are now, get this stuff, read where they're going to be, and get that
perfect.
stuff within the next year. And all you need to do is just keep walking up with them, and you'll be fine. And you will help your child change the legacy. So when they're a parent, if they decide to be a parent, like you're noticing, they just do it differently. I mean, naturally, because it was part of their default, because it's what they got from
Right.
you. So now it's not
Yes.
so hard. I have an almost 6-year-old and almost 3-year-old granddaughters. And I remember when the older one was, oh, I don't know, a little over a year or so, maybe 2. And she would put a blanket over her and touch herself when
Yeah.
she was getting her stories read or something, you know. So she wasn't quite old enough to give the talk like, that wonderful part of your body. Here's what we all do. We all go into our room and we go into the bathroom because it's just private and it's what we do in our culture. So I'm going to help you learn that too. But that's about 4 when they're able to kind of lock that down, you know. So you're doing a lot of repeating it, you know, during the 3s up to the 4s. But I remember my son shooting me a text. It's like, she loves her clitoris. And I'm like, well, she sounds like one of us, baby. I felt that same thing. I felt so proud, you know, that he just saw it as a normal
I
part of
love it.
life and he could celebrate it and not get wigged out about it. And I'm like, dude, this is a reflection that we did a pretty good job with you. You know, you're doing a great job with helping them just feel good about who they are.
How did your son's wife or partner handle that part of the sex stuff?
Well, here's the thing that is pretty amazing is that so I grew up in a Swedish immigrant home, and so I already had a lineage of sex positivity and being able to talk about it. So it was pretty easy for me to provide that for my son. My
Oh.
son ended up marrying somebody who's second generation Dutch. And so she also grew up in a home where people were really, I mean, some of the best sex education in the world is in Holland, you know. So Holland, Sweden,
Oh
Norway,
yeah.
Denmark, you know, Finland, Iceland, you know, those countries are incredible. And
Mm-hmm.
so she actually grew up in a pretty sex positive home too. So he just fortunately didn't marry somebody that was very different from him in
That's
that
awesome.
way. Yeah. And so yeah, I think he probably brings a little bit more comfort to it just because she's a private person in general, just to, you know,
Yeah.
but I think she's right along with him. Yeah. So
That's
yeah, that's
great.
nice.
I
Yeah.
love that. How can parents differentiate between normal childhood curiosity and about sex and behavior that may, or from that might be a concern that I should
Sure.
actually talk to somebody?
Yeah, that's a really good question. So that's part of what you'll learn in the book is like, here's the norms, right? Here's the norms. They have very particular curiosities at different ages. Like they play doctor between 5 and 6 or 5 and 7, you know, somewhere in there, you know.
Mm-hmm.
So there's these things that they do. You know, there's, I don't know, 20 to 25% of kids are going to experience sexual assault. That often, what's
That's
happening
high.
in those situations often is that kids are playing or being with somebody 18 months or older than them. So that person's bigger, has more cognitive development, right? And has a different kind of curiosity, right? Because they're that age. But
Mm-hmm.
because they have that power differential, they can manipulate the younger one. Not because anything's wrong with them. We are all human. The 2-year-olds are trying to get what they want. The 5-year-olds, the 10-year-olds, the 45-year-olds. They're all trying to get what they want, right? This is a
Mm-hmm.
human thing. But when you
Yes.
have a power differential, then you have the potential for power abuses to happen. So I'm always saying to parents and say it throughout the book, once they hit about 4, 5, 6, please make sure that if they're playing alone, they're playing with somebody who's the same age or within 12 months of them, because then the younger one will feel like they can say, I don't want to do that. That's stupid, right? And which is what we want. They're
Right.
not going to say that if they're 2 years older, or may not
Hmm.
say it if they're 2 years or 3 years or 4 years or whatever. And so then you just need to make sure doors are open and you have eyes on kids. And you can
Yeah.
hear, and
Yeah.
so if they're getting the adequate supervision, these things are kept from happening, right?
Right. Yeah.
Because so often there'll be a power abuse within child sexual abuse in a family, and if it's an older sibling, we blame the older sibling, but we ought to be putting the onus on the parents because they
Mm.
needed supervision and they were not given it. They ought not
Mm.
be shamed for the curiosity that they had. They just needed someone to say, no, you don't get to do that. Somebody to step in and say, no, dude, you don't get to do that. Or sweetheart, you don't get to do that. Because
Mm.
your younger one doesn't feel safe to say no to you.
Right.
So someone has to be there to step in to teach
Yeah.
this stuff, and yet, we have kids being left uh unattended, unsupervised with people, older siblings, older neighbors, and older cousins and older family
Uncles.
members,
Yeah.
and
Hmm.
who never got sex education themselves either. Maybe they also had people around them that didn't have good boundaries or were very authoritarian or something. And so nobody's there to intervene, and kids should not be left alone with somebody that you're not 100% sure knows how to discern how you take care of a child and put the
Hmm.
child's need first. Shouldn't
Yeah.
happen.
Yeah.
They're too vulnerable.
Way too vulnerable.
Yeah. I don't know if that hits
Wow.
at your question, but that's how
That
I
did.
think about it.
No, what's amazing is what you said is that we don't have any education for the doctors for psychotherapy, mandatory, and, all of, anyone in that position has to do
Yeah.
CEUs,
Hmm.
continuing education units. But why isn't it part of their curriculum to begin with? We have doctors that are primary care or gynecologists and really not teaching the woman about their body, how to make things work as
Yeah.
we age. I mean, that discussion isn't really, I mean, it's been my experience and talking to many other people. It's more like, oh, because a lot of OBG, and it is changing. They are male and it is changing to more female, but we still have this thing of, yeah, because we come in hysterical and men are just like, the doctors, I can't deal with this. I don't know what to do. So, how do we get some kind of something or like mandatory training for all of these people to identify people that are coming into their offices? It's a business. If you can't just do one. Sex is the number one thing that makes everyone happy. It determines so much and intimacy for the rest of our lives. Why are they not getting trained?
Yeah, it's not, we don't value it in the United States, and we never have. For example, if you go study being a physical therapist, you go to school to be a physical therapist, you will not study the pelvic region. If you want to help people with pelvic pain issues, male or female, you have to go do specialized training. Same thing. We as a country ignore that part of the body. It freaks us out. We don't know. When an OBGYN does an exam or a family doctor does an exam, they often don't look at the tissue to make sure the tissue's healthy. They're just looking, putting the speculum in and looking at the cervix. They're not looking at the tissue because they weren't trained to look at the tissue. Now, we do have some pelvic dermatologists that know to look at that, but people are going through 5 and 6 and 7 doctor's appointments before they get to somebody. Like they'll go see somebody and it's like, oh, I'm sure the pain isn't that bad. Just hold your breath. Like, I mean, it is literally a crime, I think, because there's so much trauma that you will hold in your pelvic region, male or female, so much trauma.
Yes.
And
Mm-hmm.
and yet we don't make this standard in medical study, medical school, right? And then when you go on to do specialty work in OB or whatever, you're still not given you're given how to deliver a baby. You're given some things, but there's so much you're not given. I had a doctor that I have a doctor that teaches with me. So I run an institute called the Northwest Institute on Intimacy, and it trains physicians and therapists and whatever in sexual health and understanding their sexual bias. I left a 30-year professorship to start this because we only had 5 people in the entire state of Washington trained of everybody. And I thought, I gotta do something to make this training accessible, easy to get. Like,
Yeah.
you only gotta do this. And if you
Yeah.
want to go
Yeah.
on to get certified, you just need to add this. I mean, I just wanted to make it because I thought it was a crime. Just an
Yeah.
absolute crime, right? Um, but I just it. So one of the people that teaches with me, she's a physician, and she's one of the probably less than one hand physicians in the United States who is also trained in sexual health. She's a certified sex counselor, and she went on to get board certified in clinical sexology, which you have to do in Europe because we don't even have that here. So she went to Prague to take a huge exam on all that stuff, right? And she is so rare, but so incredible because the kind of care she provides people is just not seen. I mean, she works with sex workers and she works with people with pelvic pain and works collaboratively with pelvic PTs and therapists. It's just amazing what somebody can do when they add that training, because now dealing with anything in that world feels easy to do. You feel competent to do. And so when people come in and they drop hints, which they will, you
Mm-hmm.
now hear those hints. You're like, oh, it's interesting. You just said that. Can you tell me more about that? Because I'm curious about that part of your life. Or,
Mm-hmm.
you just don't ignore it, where every other therapist ignores it because they don't feel confident and competent. Or if they do and they don't have the training, then they just jump in and unload opinions that often aren't appropriate for that
Or
particular
myths
person.
and what,
Yeah,
and there might be myths and they're not
yeah,
true.
right.
I just can't believe it. 5 people. Like, really? I mean, how is this?
Yeah,
You get it?
yeah.
I mean, like,
Now we're up to about 50, so we're getting there in our state.
still not enough.
No, heavens no. And I'm always saying to people, and they had to, when I was teaching at the university, they would put up with me. I would say, people are bio, psycho, social, spiritual, sexual. And you are only getting trained on the bio because I taught on the bio, because lots of programs don't. So I was teaching on how the body will cause manifestations of mental health situations, right? Hormone
Mm-hmm.
shifts and whatever, whatever. So talked about that. Psycho and social, relational, right? And I said, but you need, as soon as you're out of school, the very first CEs you get are in spiritual health, how you have conversations with people around whatever feels important to them, positive or negative, around spirituality for them, and
Mm-hmm.
sexuality, because that's how you round out your training on humans. Because every human that walks in your door is not going to leave their spirituality outside. They're not going to leave their sexuality
Yeah.
outside. They're going
Mm-mm.
to come in with their bodies. They're going to come in with their psychology and their history and their relationships. It's your job to be able to hear it all and respond to it, rather than, oh, I got to farm that person out to this person. So the poor therapist or the poor client feels abandoned by the therapist, and they often don't go to that referral,
Yeah.
you know?
No.
So yeah, I think the same as you. I wish that it was standard. It's not. So I'm just a
Mm.
big voice saying you're bordering on unethical treatment until you get this training done. Because you can't know. Not in our country.
No. So I know you were talking more like psychotherapists but like this would benefit every
Yeah.
physician.
Oh, absolutely.
Like,
Yeah.
I mean, I worked only with orthopedic pain management and I did some psychology because of the pain management.
Yeah.
But no, I mean, this is pure silliness that we don't have
Yeah.
this
That's right.
for our doctors. Just to tell you, when I was, because of my background and wanting believe that sex is a very big part of our lives and we need to have good intimacy. So I was in workers' compensation and we were running our functional restoration program, which is a multidisciplinary approach to treating the injured worker. So we had
Yeah.
psychotherapy, physical therapy, spiritual,
OT, whatever. Yeah.
different. But when we did these exams, I was the one who did the training with the doctors on we need to include when you're going to report them out, you need to talk to them about their sexual health. And
Hmm.
if the sexual health is being affected by their physical disabilities, that needs to be discussed in the report.
Yeah.
And they were like, oh, really? I'm like, yes, really.
Yeah.
So it changed so much
Hmm.
for them when
Hmm.
that they started doing that. It was awesome. I was really, because it was something that they never would have thought about. We can think about the mental, but not about the
I
sexual.
know.
I
Yeah.
It just is amazing, you know?
Yeah. Yeah. It's really one of the huge disservices in our country. And to me it's political and it's ridiculous. It's horrid. And we have plenty of research. We have decades of research in our country and others that shows that people choose better relationships, they get involved with sex later, there's lower STIs, there's lower teen pregnancy, um, better relationships when they're adults, more fulfilling relationships with their adults. And if they've gotten comprehensive sex education from home and school, kids will describe themselves as closer to their parents overall because they
Mm,
feel like if I can talk to my parent about this or my parent can talk to me about this, I can talk to them about anything. So
yeah.
their parents are actually seen as a resource to adolescents,
Hmm.
right? But if you show that you can't handle them, then they go underground and they'll go to somebody else.
I always told my kids, if you want to know something, come to me. You may not like the answer, but I will always tell you the truth.
Mm-hmm.
Always. So I became that person for them. And I go, sometimes people are taught in some ways and it might not be the right way. So if you really have a question, come to me. If I don't know, we'll look and we'll come up with the right, whatever it
Yeah.
is.
Mm-hmm.
And that's how I built my trust with my kids. And their dad and I were co-parents and did an amazing job. He wasn't very keen on my level of sexual health. But he did such a good job. I mean, like I had to call him over. We have to have a conversation and
Mm-hmm.
sometimes it would be very uncomfortable for him, but he was a trooper through it. And because of that, our kids are really honestly really well grounded in that area. So it makes
Yeah.
me feel good.
Yes. Huge
Yeah.
thing.
So, and I'm sure you with your son and now your grandchildren.
Right.
I
Right.
mean, we can
Yeah.
see the difference and I can see the difference
Yeah.
in kids around.
Yeah. It's huge. It's huge. And the research supports it, And so when people say, oh, no, you shouldn't talk to children about X and Y or whatever. I mean, I can remember one time I was even sitting and a mom of one of my grad students, um, I mentioned something, my daughter was there and I was mentioning something about conversations around sexuality. And she goes, oh, no, no, you don't do that. And I said, oh, that's so interesting that you think that you don't. I said, it's actually protective for your children. They then know how to protect themselves when you have these conversations. And she was just looked at me and she was like this. And I said, it's all right. I mean, I know that there's a big message out there that you don't do this and that that's what's protective, but it's actually not what's protective. And we know that from research. We know that from other countries that have been doing this for a long time. And so I said, I get why you think what you think, but I just have I'm a different awareness, you know. So a
I
lot
love
of
that.
people are like, absolutely don't, because it'll make kids want to do it, or it actually doesn't. It actually makes kids go, oh, I have a higher standard. I
It
want to be treated
does.
well. So,
Yes,
mm,
it does. In fact, just to, say something about my own personal experience, because I feel like I use myself as a human subject. I've done things because I was at my degree. One of my degrees was in early childhood development because I loved it. And so I was really big on this. But I remember my children when, oh God, I just forgot what I was going to say. What was it that you just said again? I'm sorry. This is called
no,
55.
that's okay. I think you were
Oh,
gonna say
but go ahead.
something about your kiddos and something that you learned using yourself as an example with your kids, or maybe
I
your own
did.
life.
Oh, here's what I was going to say. Starting them really young, communicating about it. When they got into high school, I was big on, you know, masturbation.
Sure, sure.
If you need, I'm like, that's what you do. It's fine to do it. It's
Hmm.
whatever you need to do.
Yeah,
Okay.
yeah.
Take care of yourself in the privacy of your own room and whatnot. So eventually they're in high school and we had moved to a different county than where we used to live. And so we don't know a lot of the parents. And one of the parents were actually encouraging the kids to have sex and go meet girls and have sex. So my kids would not go over there. And they
Hmm.
go, I don't want to go over there. That's not what I want to do.
Hmm.
We had girls at our house. We had all doors were open. I had rules, all
Yeah,
that stuff. But I kept it so neutral. They didn't have sex until like they were 17, 18,
yeah,
because they were much more confident about themselves.
yeah.
And I see that now that you're saying this. It's like I'm I'm going to pat myself on the back. I'll
Yes,
tell their dad we did a good job, but it's like I think it is a difficult thing, and especially with you being open-minded, I'm open-minded. Some people are not as open-minded. If you can't do it yourself, then get somebody that can help you, someone
that's
like
right.
yourself,
That's right.
and but don't ignore the problem.
Yes.
Don't
No.
ignore it because it'll
Especially these
manifest.
days. Yeah, because kids are getting exposed to so much that's so over their head because of social media and whatnot. And it's more dangerous now, I think, to ignore it than to educate yourself. Go. I know it's uncomfortable. Start with getting my book as a place, because then I'm going to point you to, here's the other books you want to read that are going to help equip you so you can equip your child to protect themselves when they're at school and out with friends. They need your support. They need your help. And so I keep inviting parents. I need for you to be brave, to face what you're afraid of, and I will help you. I will
That's
walk you
awesome.
through it, because you can do this. And because for some kids, it's going to mean the difference between trauma and not having trauma.
Yeah.
For
Well,
lots of
and the
kids,
other thing is, it'll help the parents too to deal with the trauma
yes,
that they had from
exactly,
their past and understand the myths that were there so they can get those away to have a better relationship with their partner. So it's
exactly.
kind of like a double thing here. You're
Yes,
getting two things
absolutely.
in one. Huh?
Yeah, yeah, absolutely. And it's been fun to watch those parents that have done it, as I've done this work now for so long. And I mean, I've had parents that were like, their kids were little and they're doing their own work and they're like, oh gosh, I want help. And so I give them stuff when their kids were little. And then this is before the book came out. And then I remember this one group of like eight couples called me up and they said, what would it take for you to come do a class for us on how to do adolescence? I'm like, it's not going to take much. But I'm not going to do it right off the bat. I'm going to tell you, here's 5 books I need for you to read because we're going to cover all of these subjects. And I want you to wrestle with this stuff before we sit down. I don't want you to hear it for the first time from me. I want you to struggle with it. And then you've got questions when we start. And then I did an 8-week class at one of their
Oh,
houses.
wow.
And we just hit all the different topics. And now all these kids are just now graduating and going off to college. And it's so fun to hear how good these kids are doing and how great their relationship with their parents are, and I'm like, they all gave their kids an entirely different experience than they got. And they're reaping the benefit because they did that hard work. Like, they looked at their shame and the crap that they went through, and they just kept being brave and going for it, and it's so fun to see because, and I say this all the time, you can change the legacy in one generation. If you do your work, you can do this.
Yes,
Yeah.
yes,
And that
yes.
makes a world of difference.
Huge. No, so that was your own little research project that you did, and I don't, but now you could get the kids to I mean, look at that. That's
Yeah.
huge. I
Oh,
love
it's
that.
huge. It's huge.
Now the other thing is, excuse me, the pollution here has been bad from the fires. Um, do you have that 8-week program that you're going to be doing possibly and offering that later for parents?
I really hadn't thought of it. So much of it is basically in shameless parenting. I mean, all the books that I had them read are all in there, at the different age levels, like 10 to 12 and 12 to 14 or whatever. Um, but yeah, maybe someday I'll do it. Yeah. I mean, I love doing that kind of thing and sitting down with parents and saying, okay, so let's talk about this aspect of adolescent development. Let's talk about this
Mhm.
aspect. And let's talk about what's scary about that for you, and all of it. And what was it like when you got that, and blah, blah. It's so much fun. It's so rich, and so many parents that I've worked with, they want desperately to do it different than was done for them, but they just don't know, and they're scared, and they just really want somebody to hold their hand,
They do. They
So
do. Exactly. Well, this is great. Well, I'm going to wrap us up here and say thank you, Dr. Tina, for coming on and explaining how to feel less shame around sex. Now, we definitely have to have you back on for your other book because that's like another one that you had said. But there's so many other things I want to talk to you about. And I think that you could help so many people. And I just love the information that you provided today. And I know my
oh,
listeners will too. So thank you
thank,
very much for coming on our show today.
yeah, thank you so much for having me. This was a joy to talk to you, and anytime, I'm happy to come back.
Okay, thank you.